today is the issue around how do we think about models of getting rigorous evidence on very complex social interventions. And so I'm going to draw very heavily on my academic work at the London School of Hygiene and Tropical Medicine, where for the past 20 years I've been doing research looking at violence against women. So first thinking about actually can we study it, moving on to what can we do population surveys to understand what is the level of violence that women experience around the world and how do we do that in an ethical way, to how do we do something about it and how do we test interventions. And I'm going to focus particularly on the intervention part of my research experience, given that we're talking about evidence on effective interventions. So before I get on to the issue around violence against women, I just wanted to show a few slides to kind of set the scene. And the first, I think it's always really good at the start of a talk to think, actually, let's look at where we've come from and how far we're going. And this is a slide that many of you in the room will be familiar with, which is showing the trends of impact evaluations published by year. And some of the key kind of landmarks that have really sort of helped catapult the volume of and increase the volume of impact evaluations that are being published. So back in the early 90s, really there weren't many impact evaluations around to inform evaluation evidence. And then we start to see a growth of momentum about the need for rigor, the need for development to be really formed by rigorous evaluations. We saw statements from OECD, but also then a number of subsequent initiatives, many of which DFID had supported and really invested in quite heavily, including the foundation of 3IE in 2008. And we were just at the 3IE board meeting yesterday where we were discussing, well, how do we celebrate next year 10 years of 3IE and really looking at this trajectory, how far we've come. But I also just want to reflect that we still have a long way to go. And this is a distribution from an analysis of the repository of existing trials, just looking at what sectors are covered by those various evaluations. And that big orange blob at the bottom is health, nutrition, and population. And it really reflects how a lot of the evaluation thinking came out of the health sector, essentially. And it really still very much dominates the body of evaluation literature that we have available to us to inform development practice. We also see quite large chunks, and I think very encouragingly large chunks of evidence on education and also on social protection. But there are also many gaps. We see some areas that, if you think about OECD investment in aid, are quite underrepresented. So, for example, in humanitarian intervention. So our distribution isn't reflecting investment practice or where we might, in particular, need to get more evidence. Now, clearly not all areas of development practice are amenable to RCTs, but that doesn't mean that we shouldn't be trying to match the supply of evidence with where the demand is greatest and where the gaps might be both in terms of sector area or in terms of geographic focus. And so I'm pleased that there's going to be more discussion about synthesis on humanitarian evidence, because as a donor, where 50% of our bilateral spend is committed to focusing on humanitarian settings, it's an area where we recognise there's huge evidence, a dearth of evidence, and where we really need evidence to ensure that we're really making a difference and know how to deliver aid effectively in those and emergency responses in those contexts effectively. Another piece, I think, where we are still trying to figure out how to make progress is the methodological challenges. So what are the kind of methods and approaches that allow us to get a more evenly distributed pie chart that really gives us rigorous evaluation evidence across the spectrum of development practice? And there was a working paper from 3IE that I found quite interesting that came out in 2015 that was sort of talking about knowledge-driven evaluations and decision-focused evaluations. So, and it was sort of bedded in the question of, well, we've got all these evaluations, but are they really being used? Are we seeing evidence really driving decision-making, really informing practice on the ground? And the sort of distinction made was that sort of knowledge-driven evaluations tend to be sort of coming from an external perspective. You know, if they're seeking to build evidence of interventions with high external validity, they want to look at, understand mechanisms, and contribute to development theory. So they have this sort of academic, maybe international sort of development perspective. And in contrast, you can think about decision-focused evaluation where maybe the motivation is coming much more from the program or the agency that's delivering the intervention itself, where there's a gap in evidence identified, and the key objective about that evaluation is to answer a question for that program, be it to scale up, be it to replicate, be it to change the way that a particular intervention is being delivered. And I think the paper went on to say, well, actually, you get different things from these different types of evaluation. So the source of the question is coming from a different place. The level of the role of potentially an external evaluator might be different. There was a suggestion that there might be very different timings in terms of how long it takes to findings to actually get out into the public domain. So with up to 5 years for external academic evaluations, which to me is completely wrong. Potentially differences in cost, potentially differences in methodology, potentially differences in concern around the external validity. How much is it? And potentially differences in definitions of success. I'm going to revisit this at the end, but I just want to flag this up. I think it's an interesting sort of methodological tension. Okay, so moving on to violence against women, and I'm going to speak a lot about this area based on my research, but I think some of the conclusions apply to other areas of sort of complex social interventions as well. So just to kind of set the scene when we're thinking about violence against women, this slide shows estimates produced by WHO and ourselves a few years ago, where we compiled population data from around the world. So did a rigorous synthesis and modeling analysis of hundreds of population surveys that get data on women's experiences of physical or sexual partner violence. And this plot shows the regional estimates. So what you can see from that, so these are the percentage of women, ever partnered women who report experiencing physical or sexual violence from a partner in their lifetime. And what you see is prevalence figures of ranging from about 25% up to 37-38%. So very high prevalences. It's a common reality for women around the world, both in developing countries and industrialized countries. So when you look at those figures, as good public health professionals, some of you will be, we have to do prevention. We have to think about prevention. When you think about the scale of violence, clearly we need legal services, clearly we need support services, we need health services, but we need to be thinking about prevention to address an issue that is so common and so widespread. When we look at the evidence on what drives risk, what the evidence points very strongly to is that there isn't one risk factor. There's a combination of factors acting at different levels that ends up increasing a woman's risk of experiencing violence or not, or a man's risk of perpetrating violence or not. And there's factors linked to the man's history, to the woman's history, to the sort of context in which they're living in, both in terms of their family and their community, and also the broader contextual environment. So then, when you think about, well, what does that mean about interventions, there's a huge array of interventions that a policymaker could be thinking about. If they're thinking about, I care about violence, it's in the SDGs, what do I do to tackle this? So there are interventions to tackle, for example, a risk factor linked to exposure to violence in households. There are interventions around transforming social norms, around the acceptability of violence, acceptability of gender inequality. There are structural and policy level interventions you could be thinking about around women's status, around access to assets, around divorce and so on. There are interventions around alcohol. You know, heavy alcohol use can exacerbate the frequency of violence and the severity of violence. There are interventions around relationships. There are interventions around women and girls' empowerment. So there's a lot of interesting opportunities in terms of interventions. There are a lot of groups working on these different types of interventions. There's a huge amount of innovation coming out of the NGO sector in particular, driving, trying to do something about this very common and important issue. And so in the development space, what we're seeing is that researchers are saying, well, what works? Let's develop an evidence base. But also NGOs and the implementing agencies are being asked, well, does it work? So you have the demand for evidence not only coming from academics, but also being asked of NGOs and international organizations. What is the impact of what you're doing? What are the types of investment and what are the types of intervention that really make a difference? So the natural thing is to bring those groups together and say, okay, how do we generate that evidence? But you have that spectre of potential conflict of interest when you're bringing together researchers with NGOs and international organizations. So we know in evaluation, independence is a critical element. We need to ensure that evaluations are not subject to bias in the way that they're designed and they're conducted. And so that begs the question, how do we get this right? How do we do this in a way that doesn't violate the quality of the evaluation or the robustness of the findings? How do we make, are those partnerships what we should be investing in? If they are, how do we make them work? How do researchers, when you're trying to engage and set up a partnership, manage the valid fears that NGOs might have about issues around trust and credibility of researchers or evaluators? Might the researchers misunderstand or distort the program concepts? Often the interventions you might be trying to evaluate are complex, they've been developed over many, many years. So does a researcher who flies in, who maybe hasn't got a lot of experience, can they get it? Can they really do something that's credible and meaningful? How do you manage the issue about risk? Violence is highly stigmatized. So are there risks if you start to publish findings that show that a particular ethnic group or particular community is experiencing higher levels of violence or others? How do we handle the sensitivity of the issue and potential repercussions for the communities that the research is essentially trying to serve? How do you manage the risk that findings might be propelled up into the international space from a particular context without really communicating the meaning of what's happening and the contextual understanding of how that program works in that context? And might there be negative repercussions for the implementer who's essentially agreed to this research partnership? So how do we manage that tension? And how can we make a partnership between an evaluator and an implementing agency work so that we respect the expertise of the implementing agency? We don't blind an implementing agency with the technical detail or without respecting the expertise that the implementing partner has and the depth of experience in the topic area. And how do we do that in a way that in the end still gives us rigor, still gives us publishable findings, gives us findings that can be useful to contribute to real public goods. So I'm going to go at giving you a flavour based on the work that I've done and other colleagues in the Violence Centre that I used to lead at the London School have concluded, and it's findings that we've actually published in a recent paper called Rigged or Rigorous. So please do check that out if you want more detail. I'm going to talk now about how it worked for the most recent intervention trial that I've been involved in, which I finished shortly before joining moving and seconded into DFID. So this was a randomised controlled trial to evaluate the impact of SASA, which is a violence and HIV prevention program. And this was an intervention that is implemented by a Ugandan NGO was developed by a Ugandan NGO called Raising Voices, and then implemented by its sister NGO called CEDAVIT, the Centre for Domestic Violence Prevention in Uganda. The intervention is basically an activism intervention, so it's an intervention that tries to take a community through a process of social change. This Raising Voices has spent a long, sort of 7 or 8 years piloting different components of this intervention and then documenting it and really describing what are the stages of activity, the range of activities that you do to try and think about taking a community through a process of even starting to think about the issue of violence. And the way they frame it is talking about power and inequalities in power and how abuses of power can play out, through to raised awareness about what are the impacts of violence, to start to support discussion about what might be different ways to use power in more constructive ways, to challenge some of the acceptability around the misuse of power, the use of violence, and then action to try and consolidate and synthesize change at a community level. And I would encourage people, if you're interested in the intervention components, to go and check out Raising Voices website, because there's some really good materials, quite in-depth materials there. And so what it looks like in practice is that there are multiple strategies that the intervention uses to reach out to all levels of the community. So it's very much building on that ecological model, those concentric circles, to say, to achieve change, we need intervention activities that work with stakeholders that support male and female community activists. And so there's a range of activities, both media-based, but also a lot of one-on-one dialogue and group-based dialogue that the intervention uses. And the content of the intervention evolves over time. So trying to take the community through from recognizing an issue to supporting community members to really do make difference, to make change. So the other reason I'm talking about the SASA study in this forum is because it was funded by, sorry, I haven't got the donors on here, but it was funded by a number of donors, but including 3IE. So I thought it was a good opportunity to also showcase their contribution to this work, and I gather there's an evidence brief or something linked to it as well. So what, in terms of the partner violence prevention evaluation field, the evidence base to this date was being very much, we're seeing a number of interventions, including interventions that I've been involved with, that show that we can prevent violence. And so, you know, showing you those prevalence figures of 25-30%. We have now a number of trials that show that you can halve the levels of violence that women experience over programmatic timeframes. So the first one was a trial that they implemented in rural South Africa that showed a 55% reduction in women's experience of past year physical and sexual violence. So the stage where we were doing this intervention, we sort of knew there are some models that can prevent violence. What we were doing here is saying, but what that evidence was very much measuring is, if you do an intensive activity with a group of people, does something happen in their relationships? Are those people at lower risk of violence? What this study was trying to look at is, do we see, when we look at a community-focused intervention, the diffusion element, do we see community-level impacts? And so that was the first study to really do this. So the study had a randomized controlled trial involving thousands of male and female respondents. It had a complementary qualitative component, it had operations research, and also had an economic evaluation. I'm not going to go through the methods by any means. But to give you a snapshot of it, it was an underpowered cluster randomized controlled trial. My history of research, I think, in this field is that we struggle with resources to do very large randomized controlled trials. Often we're working with small partners, but still we plug on and think about how do we try and ensure that we have rigor, but recognize often that we have limited statistical power in what we can do. So the intervention was implemented in Kampala, and we very carefully mapped Kampala, identified pairs of intervention, pairs of communities that are very similar. We very much drew on the NGO facilitators, community activists, to help us map and really understand the similarities, differences between those communities, so that in partnership we agreed what are the pairs of communities that we then randomized to either getting the intervention or being waitlisted to get the intervention at the end of our study. So even from that design stage, having the partner on board, helping us think through how do we how do we set up the sampling, how do we really understand how to set up those pairs before we then randomise, was that their partnership was really, really useful for us. We had buffer zones between our intervention and control communities, because we also were very aware, because we're looking at a social diffusion intervention, the risk of contamination that we could be facing. In the end, we did a baseline in 2008 and follow-up survey in 2012, and that documented as trying to assess the impact of 2.8 years of programming. So the programming was running after our baseline survey in the intervention communities. There was some disruption, there was civil unrest, there was a lot of violence happening. And so again, that partnership with the implementing agency, in terms of implementing the operational research, implementing the quality research, was really critical so that we could ensure the safety and well-being of our interviewer teams and our fieldwork teams while we were doing the work. When we look at the baseline data, the intervention and control communities were highly similar. So I think the matching and the process of matching that we went through with the partner worked very well. Just to say, in terms of the compromises when you're working very closely in partnership, the program had said, why don't we just do one intervention and one control site? Why don't we just divide Kampala in half? And we said, no, you can't do that. We tried to go for a higher number of clusters, but then when we did the mapping and then we looked at what's feasible for the program, this ended up being the compromise community, the position. So I think when you're bringing those partnerships together, these are the sorts of conversations that you end up having and that you need to have, so that you end up evaluating something that the intervention implementers feel is comfortable and that they can deliver, but also you're trying to make it as rigorous and as robust as you can, but recognising the constraints that the agency might have. We then developed a logic model, and I don't want to interrogate you, work through all of this, but just to show it's complicated. This is a complicated social intervention. We had a lot of discussion about what goes where, and really with the program, a lot of discussion between our embedded field workers and the research staff about, well, actually, what goes where? What are the kind of pathways of change that the intervention is trying to achieve? And what are our main metrics of success? What are our impact indicators? And so in the end, we focused it on 4. One was on social acceptance. The second was in decreases in experience of perpetration of violence, improved responses to women experiencing violence, and decrease in HIV and sexual and reproductive health risk. So there's a lot of discussion about, well, what are those metrics? And it's a scary thing. If you're the implementing agency and you say, actually, we're going to judge whether it works or not, and whether we can show you've experienced violence, you have to have trust in that the methods and the rigor is there, and the courage to say, we're going to listen to this, and actually, if it's showing there's no impact, we're going to take it on the chin. So I think that partnership, recognizing how hard it is, but also the importance of that discussion in that process. So it isn't us evaluating the intervention, but we're working together to do rigorous science, rigorous evaluation to inform that program, I think is what we are very much working to achieve. In terms of the improving responses to women experiencing violence, we knew from the outset that there was no chance in hell that we would have a significant impact on that. Because if you think about what's the prevalence of women experiencing violence, what's the proportion who might receive a response, the statistical power for us to, even in any way, to have an effect on that, we knew we couldn't do it, and we discussed that with the program at the start. And they said, we don't care. We know it's not going to be significant. Reflect that in your protocol, but what we care about is that those outcomes reflect what we're trying to do. It doesn't reflect your statistical construct of what you have the power to detect. This is showing us what we're really trying to do, and we want to use that. And so again, I think for me as an academic, it's interesting to say it's not all about statistical power. It's also about, when we're thinking about these evaluations, what is meaningful for the program that you're working with. Okay, so moving on quickly to the results. I mean, the program was implemented in the intervention communities, like I said. There was 400 activists, male and female activists supported. So the model is to support community members to become activists versus deliver something. It's to support a process of change from within the intervention. There were thousands of activities. The MNE counted 11,000. There could be more. And sort of direct context with at least 260,000 community members in 6 parishes. Summarising our primary impact on our primary outcomes, the red is the areas where we hypothesised we would have an improvement in the outcomes, and that shows you what we achieved. So we had improvements in all of our outcomes in terms of improvements in the lack of tolerance to partner violence by men and women, improved acceptability that women can refuse sex by men and women, and then that one-on community responses to violence, and you can see that big confidence interval there. We knew that we were going to have that given our sample size and number of clusters, but going in the right direction. And then in terms of outcomes that we hypothesized would decrease, we had reductions in women's experiences of physical violence, but not statistically significant, sexual violence, and then significant reductions in past year sexual concurrency. Again, all the indicators going in the hypothesized direction, some with significant, some without. The past year physical violence, the effect size is about 52%, and lastly, these are the measures on community level impact. So this includes people who both directly received the intervention, but also people in the community who didn't receive the intervention. What's interesting when we look at people who directly received the intervention, the effect sizes are pretty similar, which suggests that actually it's not the direct contact is the critical thing, it's that diffusion element is very important. We then did, we've been doing since the completion of that study a range of secondary analyses. And that includes understanding what happened to people who had a history of violence before the intervention started, what happened to them, and what happened to people who didn't have any violence before the intervention. Did they continue to not have violence, or did they have violence? And what we see, and if I just focus on the bottom block, is that our outcomes on sexual violence, emotional aggression, and on physical violence become significant when we look at the subset of recipients who had experienced violence prior to the intervention. But with similar or slightly less effect sizes, so adjusted risk ratios of 0.42 for physical violence and 0.68 for sexual violence. The other piece of analysis that we've been doing subsequent to the trial is trying to get a handle on what the pathways of change are. So this is a complex social intervention, and the intervention had an underlying theory of how change would happen. And so what we did, because we collected data from that logic model, that detailed logic model, we've been working on secondary analysis to say, well, actually, what is important out of all of those elements in contributing to reductions in partner violence. And what we see on the women's side is the importance of their attitudes about the acceptability of violence and the right of women to refuse sex, and also women's expectations about the role of men in their relationships. So we're actually challenging some of the elements about what men should do versus women should do. On the male side, the things that came up as being important is males' attitudes towards the acceptability of violence, and again, the right for women to refuse sex, men's expectations about gender roles and relationships, and the issue of suspicion of infidelity. So that came out as very, very strong, that men who were very suspicious about their partner and that she might be having other partners, that was an important contributory factor to violence that the intervention tackled. And then the biggest influence in terms of risk was the community level factors. So not factors acting at the individual level, but at the community level. And that was community level attitudes around gender roles, around the acceptability of violence, about the dynamics of relationships and sexual concurrency. So this, secondary analysis very much supports that it's a community pathway through a social norm change that has led to the impacts that we documented. The qualitative data was also very important in informing that analysis that I've just shown you, but also helping the intervention think about what might be future next steps. So what the qualitative data, and what we did is we took the quantitative data and we looked at where are households where we know there's been change at follow-up, and then we did embedded qualitative interviews with households, with men and women where there had been change. So really we use the quantitative, we nested the quantitative in very purposely to say, let's understand that history. And what the sort of narrative, overall narrative, and this is coming from a PhD student that analysed this data, is the how issues of lack of communication, income security, stresses, and rigid expectations about relationships end up leading to violence happening very early in relationships. You might have the sort of early excitement and romance of a new relationship. There's often a baby that comes along pretty quickly, but then the realities of being poor and having very limited economic options hits quite heavily. And the structures to respond to that aren't really there. And so what people talked about was that the intervention helped them to try new ideas, to go, actually, is it the man that has to always provide, or actually the woman has ideas about how to make money? So there were very strong qualitative quotes about the importance of communication, of actually thinking about working as a team, doing development together, versus being stuck in a sort of rigid and maybe historical expectation of what a woman's role is and what a male roles will. Improved intimacy, improved decision making, and so an overall improvement in relationships and family life. I think always when you do an evaluation, you kick yourself once you've done your analysis about what's the stuff that you didn't include. And for me, this really highlighted, I wished we'd had outcomes that were trying to get broader measures of household economic well-being, broader measures about what's happening to kids in those relationships as well. And so again, and using these findings, the interventions very much starting to think about those broader elements of what their intervention might be achieving. So expanding out and thinking about it as an intervention solely around violence and HIV. So in terms of the study, it's got a number of strengths. I've told you that it's looking at community impact. We had a strong partnership. We had mixed methods. And I think we're seeing a lot of consistency across our outcomes. Clearly, there were limitations. We had to deal with the disruptions of political events in Kampala. We had a limited statistical power. But I think the conclusions point to some significant impacts and policy impacts. I'm not going to repeat them. In the economic evaluation, this intervention cost about $1 a day per activist supported, so relatively cheap. If I go back to that slide that I showed you about the different focus of evaluations, I hope I've shown you through some of the science and analysis and the rigor that we tried to bring to this study, is that these don't have to be separate worlds. So, this intervention, you could say it was a knowledge-focused evaluation. It was experts from the London School coming in, it had external donors and so on, coming in with an interest in developing a global public good from this partnership. But in practice, because it was working very closely with partners, we had embedded researchers, we spent a lot of time discussing every element of the design. I think we ended up also having immediate impacts on the way that the intervention is being operating. And really supporting a lot of what they're doing, the aspirational focus, the discussions around power, the importance of the community focus and the intensity of what they're doing, helped highlight some of the key norms that are really important, that they really should be focusing on in terms of achieving impacts on violence. And that it's not just norms, it's also the skills around how to manage conflicts in relationships. That partnership also led to kind of other direct elements that we haven't published. It doesn't fit in with the academic metrics of success, but I feel kind of proud about still, which is the sort of innovation when you're doing those sorts of partnerships, to think about, well, how do you use the finding and insights you get from doing an RCT? How do you feed that into supporting an NGO that cares about trying to understand the impact of its programming? And so, for example, during the research progress, we played about with quite a lot of innovations to think about how do they improve their M&E. So how do they move from counting how many activists they have or how many education activities they've had to thinking about, well, are there ways to replicate or learn or sort of draw from research and evaluation methods? So this is it's not very clear, but it's basically a checklist that we developed based on our discussions around what are the key attitudinal changes that each phase of the intervention is trying to achieve, that was used by supervisors for the intervention, so they could sit in on a community discussion and tick off, well, actually, where are they? Are they still saying violence isn't an issue, or have they shifted? And actually, the discussion is much more about, people recognizing violence as an issue, they're recognizing we're not just talking about physical violence, but also sexual and psychological abuse, or they're starting to talk about how do we do something to tackle violence. So these sort of simple tools came out of the research process and the discussions about what the intervention is really trying to do. We also did things like develop rapid 20-question attitudinal surveys that the NGO then started to implement in the community, that was trying to draw on the approach of how do we do a replicable sampling methodology and implement that in a very low-tech way, but at least to understand what might be trends and attitudes that are happening within the communities that they're working with. So there were some kind of quite immediate inputs that came out of, in terms of M&E and trying to strengthen the M&E processes from the research partnership. To let you know where SASA is, it's now being implemented in the control communities. I think when we're thinking about the ethics of research and evaluation research, that the ethics of ensuring that control communities receive the intervention is really important. It's now being used very widely. I mean, it's been implemented in more than 15 countries by over 50 organizations. Raising Voices is very much an organization that supports wider delivery. It's also being now used by the government of Uganda in one district, Busoga. It's been adapted to very different settings, so there's a major adaptation in Haiti, and there's some work, there's quite a large program in Ethiopia, for example. There's a focused version of this SASA faith-based organizations, and there's a new adaptation that's about to happen for the Pacific Islands. The NGO continues to struggle with as we think about scale. How do we do that? How do you capture that element of social mobilization and change at a large scale? If you're taking an intervention to different settings, how do you ensure the core focus on gender and power inequalities? How do you ensure sufficient fidelity, and capture the essence of activism and social change that the intervention delivers, but don't let that be a limit to innovation and testing new approaches. So, sort of in final comments, I just want to reflect back on that slide and there's typology and maybe the distinction, the separation between decision-focused evaluations and knowledge-focused evaluations. And in this case, I believe that by getting that partnership model right, investing quite heavily in that partnership model, we can actually get between the two, and we can get a lot of both. By having that close working relationship, you are thinking about global goods, but you are meeting the needs of the program itself. You have technical expertise, but it's embedded in, so it becomes less separate. The findings that you're getting from your qualitative work is feeding back in immediately because your implementing partners are part of the conversation all the way through. There are compromises potentially on methodology, so I said about the number of clusters, but actually the value in other aspects of rigor I think can't be underestimated, so that we knew how to ask about violence. We were able, in a very accurate way, to structure a questionnaire that was useful and worked well. I think was very important methodologically. The external validity is one where I think the secondary analysis helps us understand what might be findings that have broader relevance and what might be aspects that are more specific. And then in terms of definition of success, I think we should be aspiring to meeting both definitions of success, that we can have impact and have these evaluations to support the programs that the evaluations are focused on, but also that contributes to a global good and can inform the wider field. The paper that we published, Kathy Zimmerman and I published, along with others, with some of our implementing partners, reflected on, okay, we had, in the research that the Violence Centre that I was leading did, we do this all the time with different range of types of intervention, with groups working on trafficking, groups working on violence prevention in different contexts. The kind of this sort of summarises some of our sort of thinking about that, and I'm sorry, I don't know if you can read it properly. But the kind of contributions, I think, if you bring that partnership together is, yes, the research group, the evaluation group, they bring the stuff we all know about. They bring the academic and technical skills, they know the literature, they have that credibility, they have that opportunity to open doors and get findings out to a range of different audiences. But in parallel, what the implementing partner, the NGO, the international law organisation brings that's equally valued is that real understanding of the local context and dynamics. They have the trust of the communities, and particularly when you're working on very sensitive issues, that's critical for everything that you do. They have the programming skills, they have the experience of delivering and working on the issues for many years, and they have the position and knowledge to affect programs and to influence other programmers by absorbing the findings. I think these partnerships work when you have a shared values, and for us, working on violence, it's committed to a core element about agenda focus and committed, the centre does research on violence because it wants to prevent violence, the partner does work on violence because it wants to prevent violence. So that shared commitment and shared values, even if we bring different skills, I think is critical to making the partnerships work. The commitment in this case to doing no harm, putting women's safety first, as well as scientific rigour, and recognising the complexity of the social phenomena. There are lots of constraints and issues, and I won't work through them all, but there's the risks when you bring different communities together of how do you make that work. The ways that we've resolved it in our work at the centre is really articulating that shared vision, very open communications, open budgets, also being very clear about who's getting what, how the resources dividing up, is that okay? There can be big tensions in, for example, what are salary levels of implementing NGO versus an academic coming from the north. So, but being honest about that, being valued and respectful of each other, being prepared to compromise on both sides, but based on a basis of discussion, and regular communication, and that can be really facilitated by embedding researchers within programs as you do the evaluation. So this is my final slide on the rigorous. To me, when you get those partnerships right, but you maintain your scientific rigor at the same time, and that I think we can get better quality science, better quality evaluation findings that have impact both, that responds both to internal and external needs, that is tailored to the intervention, but also seeks to draw out broader learning, and that it's embedded by the commitment and the joint partnership that the evaluation is doing, and I think those sorts of approaches are cost effective. In the end, evaluations, the value for money on evaluations really, and on evidence synthesis, depends on how much the findings are used. And so cost effective, the value for money should be, do evaluations have impact? And I think these sorts of approaches are ones that are really promising, and we should be striving to do to support more, because I think that's how you will deliver cost effectiveness and impact. Thank you.